So tell me when you first heard about the Oncotype score.
My surgeon told me about that. And so that was part of my kind of pre-op consultation.
Okay.
Preparing for everything. And basically she said, there is this new information out there that you might not need to have chemotherapy, but we won't know that until after we perform surgery. And even surgery in itself, I'll tell you, I went from my initial diagnosis to, okay, I need a double mastectomy and prepare for the worst and go from there. And when I met with her, she said, that's not even a viable option for you to think about. So take that off the table. The type of cancer that I think you have, but I'm not sure yet till I get in there, the size, all of these factors that you don't normally think about. You just hear breast cancer.
Right, get it off, right.
So I had my surgery and she said, once we take out the tumor, we're going to send it off for this test, and depending on that information, that'll help us decide if you even need to have chemotherapy.
So what you probably weren't aware of is that they take that original core biopsy that told you had cancer, and that gets sent off for the estrogen receptor and the HER2 gene.
Yes.
So that information is known usually before you actually have your definitive surgery, and then so that you can have that conversation about the Oncotype score before you have your definitive surgery, so you can be aware that just like you don't have to have double mastectomies, you don't have to have chemotherapy unless you're in this range. So once you got your recurrence score,
yes,
after your surgery, like the surgery is a big deal,
yeah,
right? And you have to have radiation afterwards. But once you got your recurrence score back, will you share what your recurrence score was?
It was 11.
And I don't know how old you are, but if you were under 50 or over 50, you're in the range where there's no benefit from chemotherapy.
Right.
When you got that 11 score, did it give you confidence in not taking chemotherapy? Because your mom had chemotherapy.
Right. Not until I had my doctor explain it to me.
Okay.
Because then at first it's like, what do you mean I don't need chemo? Every woman gets chemotherapy, and if I don't have it, then am I making a big mistake for myself? But when she showed me, and I know I'll get the numbers wrong, but looking at a bar graph and seeing this line for you don't need chemo, if I did opt to add it, the line, the benefit of having that, the lines were almost side by side. That then I looked at her and I said, well, why would I do it then?
Right.
And she's, and I loved I loved all my doctors, but she was very respectful, saying that's a decision you need to make, but medically and statistically, I can tell you there is no benefit.
Right.
So I would ask you, even if you told me you wanted to, I would really want you to have good reasons on why you want this type of treatment. So then it was like, wow, okay. So visions of losing my hair. Visions of, even though I love scarves, I've never worn them on my head. I wear them on my neck, like, okay, I'm not going to look like that. What do I do now? And amazingly, it was go get your radiation treatment. I was very fortunate that even the slight side effects that you sometimes get with radiation treatment, I had none. And that was a little bit, I'm still holding my breath, I'll be honest. Because you're like, okay, I go every day and I do this treatment, what's gonna happen? And part of radiation too, they say, well, you may experience some burning, like a sunburn.
Right.
But again, that won't happen until your
Later.
treatment's done.
Yes, right.
So you're still holding your breath.
And then I presume you're put on an estrogen blocker of some
yes.
kind. Right.
And that's where I'm at now. Done with radiation, and I call it my multivitamin for breast cancer. I take a pill every day, and I will for about 10 years. And then just follow up, and you think, that's it.
Right.
And it didn't really hit me until I had a neighbor come over with her two pre-teenage daughters. And we were just catching up, and she kind of pulled me aside and said, her older daughter, she goes, she's really been worried about you because she heard you had breast cancer. And I think she's a little nervous to ask you questions. And I turned to this young girl and I said, I'm the new face of breast cancer. I said, I'm okay. I didn't get sick. I didn't, lose my cookies after I ate all the time. I didn't become gaunt or pale. And could have stood to lose a few pounds, but that's just us women,
Yeah,
right?
you need to know that most women on chemotherapy for breast cancer gain weight, so you're okay. Don't worry about that. I think the nice thing about having this personalized medicine, you need an estrogen blocker because you have an estrogen receptor, and you don't need an anti-HER2 therapy. Your HER2 is normal. And you have a 21 gene score that's sitting in the range where your cancer will not benefit from chemotherapy. And it's a way of just having confidence. We could throw everything at you. We could remove all breast tissue, given you chemotherapy and estrogen blocker, and you'd be exactly at the same prognosis you are right now. And
That's
so
amazing.
It's not just quality of life, it's getting the right therapy for your cancer so that you can live an optimal life. And even though people don't want to go through chemotherapy, if your cancer is telling us you need chemotherapy, then you have to embrace that as well.
Right.
And I know you would have if that's what you had been told, because we all want to live and we all want to live a normal, long life. And it's a blessing for all of us that this research, a lot of which was supported by Komen, has allowed us to what we call decelerate therapy and really try to minimize the huge impact these cancers have had on people that will last the rest of their life.
More is not always better.
Right.
But
Right.
very happy to see you are where you are, and like the confidence with which you can go forward with your treatment. That patients that I've spoken with, whether in my family or just who I've met, it's that fear, right? And feeling really confident that you've done everything you needed to do does a lot for a patient, for quality of life, for just how to move forward. So thank you so much for sharing your story.
My pleasure.